Keeping Melbourne in lockdown. Let's have a look. Hello everyone, Florian.Heise here, and welcome to another episode of HeiseSays. Grab your stein of coffee and let's have a look at a few articles discussing, well, the lockdown in Melbourne and how, well, the end is not quite in sight. So, ending the lockdown early could blow out the recovery, and this is according to a leading coronavirus expert. He's warned against lifting the city's brutal COVID restrictions, claiming it could blow out the recovery plan. You've got to stick to the plan, people. You've got to stick to the plan. Even though other well-known and famous and winner of the President's Medal, epidemiologist D.A. Henderson, argued against many of the severe lockdowns and restrictions that have been imposed. An Australian epidemiologist has warned against reopening Melbourne early. Speaking with Sunrise this morning, Melbourne University epidemiologist Professor Tony Blakely claimed a premature easing of restrictions could blow out the recovery plan. Or here's just a counter-argument, an alternative position, or it could show that the severe restrictions, the removal of liberties, the price that we're paid may not have been necessary. It just might. He said, while it would be lovely for Melburnians to have more freedom sooner, it would be lovely for you little proletarians to go about your activity. You know, that's it. Go. Have more freedom sooner. Those liberties should only come when we get to 5 or less cases at the end of October. 5 or less cases. This is insane. Utterly insane. This really feels like mass hysteria. It really does. And people are now that they're just going to have to go along with it. The thing is, the politicians, they can't back off. They're committed. It's political now. It might be better to aim at staying in lockdown for another 2 weeks and then bring the next date forward, he said. Oh, look at that. That is probably what I would advise. All for something with such, frankly, a low mortality rate. For anyone under 50, it's ludicrous. If you're a woman under 50, you're fine. Come on. And they've got the raw live coverage below. So there's a few other things I want to look at. First, there's this article here. This article. This is from the Sydney Morning Herald. And 60,000 more people may have had COVID-19 than detected, according to a study. 60,000 more people. Now, this is, well, putting some weight to the argument that perhaps more people have gotten the illness than anticipated. It's much more milder than some people realize. People have it and don't even realize they've got it. And think, oh, you know, maybe, should I get tested? Oh, no, it's not worth it. I feel fine. It's just the cold. Oh, look, it's gone the day after. Or I'll get tested. Oh, no, wait a minute. I'm not feeling anything. Research by some of the nation's most senior scientists has found that more than 60,000 cases of coronavirus in Australia could have gone undetected, potentially adding to cause to ease restrictions sooner. Well, we have another epidemiologist arguing to keep Melbourne in lockdown until they have 5 cases. Here, 60,000 could have gone undetected. The federal government funded study by a team of researchers, including Australia's Deputy Chief Medical Officer, Dr. Nick Coatsworth, estimates that by July, before Victoria's peak in cases, 71,400 people may have contracted the virus. At the time, there were only 11,190 officially confirmed cases in Australia. Now, if this is accurate, just think what it does to the morbidity. Guys, it'll decimate it. That would make the economic livelihood, business, and cost in lives that we're paid to mitigate the spread of this illness even all the more worse. Of those screened by researchers in June and July, 0.28% had COVID-19 antibodies, the study found, which means they had contracted the virus. Antibody testing can tell if a person has ever been infected with a virus, as antibodies remain in the blood for many months after a person recovers from infection. See, this is what I'd like to see. I'd like to see us doing more of the antibody testing, because I suspect that a lot of people have got it. Many more have gotten it than realize. Honestly, I mean, I got the flu for the first time in years this year. I got it for the first time in years, and I was worried. I thought, well, could I have this? And then it was gone. I mean, for those of you that were watching, you'll remember. You know, official. I mean, I could still record my videos. I could still work. Official federal government modelling released in April said Australia's testing program was catching 93% of all symptomatic cases. However, the new study suggests 85 to 90% of all cases were not being picked up. The study has significant implications. If accurate, it means Australia has endured a far higher number of infections than previously thought without overwhelming the hospital system. Now, I hope this is right. I really do. In one hand, I hope this is correct. I hope this study is evidence that we've overcome this. We're developing a herd immunity. Maybe we could look at the path that Sweden has approached. But if it is right, just think about how many people's businesses and livelihoods have been destroyed for nothing. That's the real sad part of it. And then what can we implement? What can we do to ensure that another disaster like this doesn't happen again? That we remove the capability from our political leaders and bureaucratic health officials to enforce such drastic measures again. That's what we need to think moving forward. We need to make sure that this can't happen again. We've had more infections than we thought, and hospitals have coped extraordinarily well. Well, because we've got, frankly, Australia has some of the best hospitals in the world. Our EDs are cutting edge. Emergency departments are cutting edge. Said Professor Elizabeth Gardner, head of the Australian National University's Cancer Department and a co-author of the paper. That put into question whether stricter lockdowns, such as Melbourne's current Stage 4 restrictions, were necessary, she said. Should we remain at that level of lockdown? No, I don't think the numbers justify it. So who do you want to agree with? The epidemiologist from Melbourne University, Tony Blakely, who was on Sunrise, or the Professor Elizabeth Gardner, the head of the ANU's Cancer Department and co-author of this paper? But the study also has significant limitations. Its sample size is too small to make a confident estimate about the true level of infections around Australia. Only 2,991 people were tested, about two-thirds of them from Victoria and New South Wales. Of those, 41 had antibodies of COVID-19. So what we need to do is we need to increase the test. We need to increase the scale. Where's the follow-up? Professor Brendan Crabb, an antibody testing expert and director of the Burnet Institute, who was not involved in the study, said the estimate of 71,400 infections was on the high side of likelihood, but not out of the realms of possibility. The antibody test used was developed by a team of researchers at the Australian National University and has a false positive rate of 1.09%. There is still much margin for error here, he said. The study's lead author, Associate Professor Ian Coburn, said it would not be too surprising that many infections had not been picked up. In the early stages of Australia's pandemic, many people were turned away from testing stations. It is estimated about 40% of people with the coronavirus do not show any symptoms. 40%, guys. The low number of overall infections tells you the restrictions work. Do they? Do they? But are they necessary? See, this is the thing. Or it just tells you we're not capturing them in the testing. He's jumping to a conclusion there. If Australia's restrictions had been less strict, there would have been more confirmed cases. but more unconfirmed cases too, stressing healthcare systems, he said. Professor Christine McCartney, director of the National Centre for Immunisation Research and Surveillance, said coronavirus cases were probably missed in the first weeks and months of the pandemic in Australia, when there were greater restrictions on who could access testing. What we probably now appreciate is that the virus was infecting people who may not have been eligible for testing at the time, she said. It does indicate that Australia has kept control of the spread of the virus. Other countries that have conducted similar antibody surveys, such as Iceland, also discovered their testing program were missing many infections. A separate antibody survey in New South Wales, being run by the Kirby Institute, is expected to release results later this week. Based on early data, New South Wales Chief Health Officer Kerry Chant estimates in July the true prevalence of coronavirus cases was between 1 and 2% of the state's population. Infection control expert Professor Mary Lewis McLeod said most other countries had reported rates of coronavirus infections in their communities of between 1 and 10% of the population, much higher than the 0.28% reported in the Australian survey. Professor McLeod said while it was encouraging to see those low numbers of infection rates relative to the rest of the world, it would be great to see more testing. I honestly still think most people are getting this, or not most people, 40% are getting it not even having any symptoms. And then I bet you there's a whole heap also that are mistaking it for just another cold. Have you looked at some of the symptoms for the mild symptoms for coronavirus? I mean, you just mistake it for having the flu or having a cold or working a little bit too hard, being tired. I would like to see both New South Wales and Victoria opening up their testing to anyone who wishes to be tested, while at the same time prioritising people who had a contact or were feeling unwell, she said. The new study was uploaded to medical research website MedRevex on Tuesday, but has not yet been peer-reviewed or published in an academic journal. Study volunteers were drawn from people entering hospital for elective surgeries between June 2nd and July 17th. Standard PCR testing can only tell if a person is infected with COVID-19 at the time of the test. There you go. Well, that's interesting. That's very interesting. So the standard testing can't tell if you had the test. It only tells if you're infected. Now, there's another thing to have a look at, and another thing here. This is discussions of the protests, and this was to the Legislative Council, asked by Mr. Limbrick to ask the Minister for Health. In relation to the Black Lives Matter protest on the 6th of June 2020, what was the number of community transmissions of COVID-19 associated with the rally? The Minister for Health: I am informed that there are no known cases of community transmission attributed to the rally. So we had huge protests in Melbourne, and here we can see public can gather, public can congregate, no known cases. Fantastic. More evidence to open up Melbourne, to restrict the lockdown. So we've got evidence here that our cases are much higher than have been expected. So that's one argument against the lockdown. We've got an example here that there's big protests, no known infections associated with it. Two pieces of evidence. Now another thing here, this is an email leak, and this could be why they want to go so hard on it, because they're damned if they do and they're damned if they don't. So a hotel quarantine inquiry, a damning email could sink Daniel Andrews. We'll have to see. So an explosive email has blown apart Daniel Andrews' suggestion that the military had not been made available to help with Victoria's failed hotel quarantine program. Now, would anyone be surprised that he would be lying? Would anyone be surprised at all? I mean, he's a politician. And, he's a particularly left-leaning politician. And if anything, if I look at images of him, he reminds me the Dilbert, weasel type of character. So, at several of the Victorian Premier's press conferences over the past 2 months, he has faced fierce questioning over why the state had opted not to use the ADF to facilitate the botched system, which has since been geomically linked to almost all of the state's second wave cases. So he buggered it up. Will he get in, guys? I think Australians love themselves some good authoritarianism. They love being ruled over. Mr. Andrews repeatedly stood firm, suggesting the help was not there. Then, in an inquiry into the system's failure last month, he doubled down. I'm glad you mentioned the use of ADF. I don't believe the use of ADF support was on offer, he told the inquiry. However, emails released in the same inquiry yesterday have smashed that assertion wide open. They show the Prime Minister Scott Morrison's office wrote to Mr. Andrews' office on April 8th, saying New South Wales had ADF personnel involved in hotel quarantine, and that the same option was there to assist Victoria if the government wanted to reconsider your model. There you go. There you go. So they're committed to this path. It's their bugger up. Then on June 24th, the Victorian Department of Premier and Cabinet Secretary Chris Eccles emailed his Canberra counterpart, Phil Gagens. The Premier and Prime Minister discussed last night the support that might be provided by the ADF in relation to the current outbreaks in Victoria, the email read. ADF security for passengers entering and exiting hotel quarantine, request between 50 to 100 personnel. Yesterday, the state's Emergency Management Commissioner, Andrew Chris, spoke at the hotel quarantine inquiry. While the Australian Defence Force was involved in the initial planning of the hotel quarantine program, Mr. Crisp told a teleconference on March 27th, 2 days before international travellers were due to arrive, they did not see a need for boots on the ground. He told the inquiry he first learned a hotel quarantine program would be created at a meeting at about 1:30 p.m. on March the 27th with Emergency Services Minister Lisa Neville before it was formally announced by the Prime Minister. By the time he attended a teleconference at 4:30 p.m. that afternoon, he said he understood a decision to use private guards was already made by the Department of Jobs, Precincts and Regions. Now, and we've looked at that I'll let you go through the rest of this on your own time. But we looked at that as well, the reasoning behind. A lot of the security guards were used, they had affirmative action programs in place. So it's been a big mess. So what do you all think, everyone? Do you think Melbourne's lockdown should be continued? Or do you think the evidence that may be there, that our case numbers may be significantly higher, would argue that, well, we don't need to reduce those numbers? And the fact that there have been huge protests in Melbourne, couldn't that also add to the argument that maybe it's time to restrict the lockdowns? And you think they want to just keep it all locked down and under control because it's their stuff up? As always, let me know your thoughts and opinions in the comments below. Please like, share and subscribe to the channel. If you're a fan and want to support the content I create, there are a few ways you can. You can join the channel on YouTube or Patreon. You can support us using our affiliate links at Amazon, eBay, Independent Reserve or Kucoin. You can buy merch from HeiseSays, use Gold Pass from the Perth Mint, or support us via PayPal. Take care, have a great day, and I will see you all in the next episode.